The compass we carry. In neonatal care, the decision to resuscitate or stop CPR hinges on the concept of meaningful recovery, not just survival, but the potential for a life with awareness, connection, and dignity. CPR may be stopped when biological signs show no return, time stretches beyond hope, parental values guide release, or symbolic recognition of death becomes necessary. This extends into broader ethical debates. In abortion, viability and meaningful recovery challenge binary definitions of life. If a fetus cannot survive or recover meaningfully, mandating birth may impose suffering rather than protect life. In brain death, a body may be biologically sustained, but without consciousness or recovery, continued intervention may no longer be care, it may be control. Across these contexts, the compass we carry points not to easy answers, but to layered ones centered on compassion, dignity, and survivor-informed ethics. Meaningful recovery refers to a state in which a patient, especially a neonate or critically ill individual, not only survives a medical crisis, but regains enough physiological and neurological function to support a life with potential for awareness, interaction, and development. It's not just about being alive, it's about the quality and sustainability of that life. Clinical dimensions. Neurological integrity refers to the ability to experience consciousness, interact with surroundings, and develop cognitively. For neonates, this includes potential for speech, mobility, and learning. Physiological stability refers to the ability of organ systems to function without constant life support. Breathing, circulation, and feeding can occur with minimal intervention. Developmental trajectory refers to the child's chance to grow, adapt, and participate in family and social life, even if some disabilities are present. The capacity for bonding refers to the infant's ability to engage with caregivers, express comfort or distress, and participate in relational life. Freedom from prolonged suffering is a key aspect of recovery. It means not enduring ongoing pain, invasive procedures, or a life dominated by medical trauma. Additionally, recovery aligns with family values, as what constitutes meaningful recovery is shaped by the family's beliefs, hopes, and ability to support the child's needs. In neonatal ethics, meaningful recovery often serves as the threshold determining whether resuscitation or continued intensive care is morally justified. It's the point where survival becomes not just possible but survivable, in a way that respects dignity, minimizes suffering, and allows for some form of flourishing. The book, The Compass We Carry, Recovery, Resuscitation, and the Meaning of Life, emphasizes the complexity of life beyond the binary notions of being on or off, heartbeat or silence, born or unborn. Real life is layered, encompassing the ability to recover, connect, feel, and grow. In neonatal care, the question arises, can this infant recover meaningfully? Can they breathe, bond, learn, and live without constant suffering? If the answer is no, we pause because survival without recovery isn't always mercy. It can sometimes be harm. We carry this compass into the most challenging decisions, such as when CPR stretches beyond hope, when a baby is born too soon to root, or when a body survives but the brain does not. The concept of a brain-dead individual highlights the irreversibility of brain death. A body can be warm and a heart can beat with machines, but if the brain is gone irreversibly and completely, there is no awareness, sensation, or possibility of recovery. This is not a coma or sleep, it is death, held open by technology. In such cases, the question arises, what are we sustaining? Who are we sustaining? If there is no path back to consciousness, no bridge to interaction, and no chance for recovery, continuing support may not be care. It may be control. We don't stop because we don't care, we stop because we do. This compass becomes particularly pertinent in the abortion debate. Recognizing that a brain-dead body is not a person is a crucial step in understanding the ethical implications of such decisions. Not because it lacks a heartbeat, but because it lacks the capacity for recovery, awareness, and relationship. Then why do we treat a pre-viable fetus as if it is already a person, even when it cannot survive outside the womb, even when it cannot recover meaningfully? If we wouldn't force a family to sustain a brain-dead loved one, why would we force someone to carry a pregnancy that cannot result in a life that can unfold? This isn't about denying life. It is about defining it with dignity. It's about asking, can this life take root? Can it flourish? Can it be held with love, not just law? The compass we carry doesn't point to easy answers. It points to layered ones, to care over control, to recovery over mere survival, to love over ideology. Because the question isn't just, is there life? It's, what kind of life are we insisting on? And who bears the cost when we refuse to ask? The suspended state of the fetus is not yet a life lived, but a life directed. It is a trajectory, a becoming, awaiting the infusion of intention. Without the parental desire to bring it forth, without the will to nurture and sustain, that trajectory remains incomplete. Abortion, then, is not the denial of life. It is the recognition that life requires more than biology. It requires welcoming, willing, and sustaining. It requires the infusion of love and intention. To intervene in this suspended state is an act of mercy on two fronts. Mercy for the one who carries, who should not be compelled into a trajectory that reshapes their body, their future, their dignity without consent. Mercy for the one who is carried, who without that infusion of intention would otherwise be drawn into a life not chosen for them, a life begun without the grounding of desire or readiness to sustain it. This is not abandonment. It is a profound translation of significance. The trajectory of the fetus is acknowledged, but it is rearticulated into the trajectory of the parent's life. The sacrifice is real, but it is not void. It becomes the seed of a new direction, a reshaping of possibility. Just as the loss of a loved one alters our own path, the loss of this potential life reshapes the path of the one who carries it. The trajectory is not erased, it is transformed. Mercy is the intentional redirection of harm, an act that transforms potential injury into meaningful release. Mercy in abortion is not one-sided. It is mercy for the one who carries, whose autonomy and flourishing must be honored. And it is mercy for the one who is carried, who cannot be compelled into life without the infusion of intention, desire, and love. Abortion is not the end of a trajectory, it is its rearticulation, a translation of potential into lived dignity. Many say, I did not ask to be born. And they're right. No one asks, but someone wills it. Someone chooses to bring forth, to sustain, to shape a trajectory into life. That will is not incidental, it is foundational. It is the difference between biology and belonging, between motion and meaning. In abortion ethics, this matters profoundly. A fetus in suspension is not yet a self, but it is a direction. And without the infusion of will, without the desire to bring forth and sustain, that direction remains unanchored. To choose abortion in this moment is not to erase a life, it is to withhold the will that makes life possible. It is to recognize that life is not just cellular, it is chosen, held, and intended. This is why abortion is not abandonment. It is the refusal to impose a trajectory without the will to carry it. It is mercy for the one who carries, and mercy for the one who would be carried without welcome. It is the steering of significance, the translation of potential into lived autonomy.